Pregnancy is supposed to be a joyful journey. But what if pregnancy carries hidden dangers you can't see? What if a simple headache or a little swelling could be a warning sign of something life threatening? Today, we are uncovering the truth about high risk pregnancy. The signs we should never ignore, and when every second matters. A high risk pregnancy means the mother, the baby, or both have a higher chance of health complications before, during, or after delivery. This doesn't mean something will go wrong, but it does mean extra care is needed. More checkups, closer monitoring, and sometimes specialized doctors. If the mother had a previous cesarean section delivery, her body carries a surgical scar, and that scar can become a serious risk. During labor, the uterus can tear open, a condition called uterine rupture, a life threatening emergency. There is also a higher risk of dangerous placental conditions like placenta previa or placenta accreta, which can cause severe bleeding, and scar tissue can make future surgeries more complicated and risky. One of the most dangerous complications in pregnancy is preeclampsia. It is defined as new onset of hypertension, that is systolic blood pressure of greater than equals to 140 mm of mercury, or diastolic blood pressure of greater than equals to 90 mm of mercury, or both, measured to times with at least 4 are apart. And either proteinuria, that is urinary excretion of greater than equals to zero point 0.3 gram per 24 hours, or urine protein to creatinine ratio of greater than zero point 0.3 milligram, or dipstick value greater than equals to 1 plus, or other signs of end organ dysfunction. After 20 weeks of gestation in a previously normotensive woman. If untreated, it can lead to HELLP syndrome, restricted fetal growth, or premature birth. But the real danger comes when it progresses to eclampsia. It is preeclampsia complicated by seizures and/or coma. This is a medical emergency. A history of abortion, whether spontaneous or induced, can affect future pregnancies. The cervix may weaken, leading to early opening and possible pregnancy loss. There's also a higher chance of preterm labor and certain placental complications. This makes careful monitoring essential. Some risks don't end after delivery. Postpartum hemorrhage, meaning heavy bleeding after birth, can become life-threatening within minutes. Massive blood loss can lead to shock, multi-organ failure, and even death. In extreme cases, doctors may need to remove the uterus to save the mother's life. If a pregnant mother is in a high-risk pregnancy, these warning signs should never be ignored because even small symptoms can signal something serious. It may begin with a severe, persistent headache, not just ordinary discomfort, but a deep, throbbing pain that refuses to go away even with rest or medication. Then, there may be changes in vision, blurriness, flashing lights, a sign that blood pressure may be dangerously high. In more critical situations, seizures or convulsions can occur. That is sudden, uncontrollable movements that indicate a life-threatening emergency requiring immediate care. Sudden, intense pain in the upper abdomen or uterus that is constant and severe can be a serious warning sign. Bright red vaginal bleeding is another serious warning, often a sign of complications that need urgent medical attention. There may also be fluid leaking before the due date, a sudden gush or continuous trickle, which could mean the water has broken too early. At times, the baby's movements may slow down or become noticeably less frequent, a signal that the baby may be in distress. Sudden swelling of face, hands, or around the eyes can appear, often linked to dangerous rise in blood pressure. And finally, marked increase in blood pressure readings even without symptoms can silently put both mother and baby at risk. If a pregnant mother notices any of these signs, she should go to the hospital immediately. Because, in these moments, waiting can cost lives. A high-risk pregnancy is not the end of hope. It's a call to be more aware, more careful, and more prepared. With the right attention and timely care, many risks can be managed. and many lives can be protected. The earlier a pregnant mother recognizes the warning signs, the greater the chances of a safe and healthy outcome for both her and her baby. Because in pregnancy, every second matters. Thank you for watching this video with patience. I hope this video was informative and you liked it.